Okay.
Awesome.
And then I can do translation too. So when they start translation would appear in this language for everyone, English. Oh, the go Zoom guests can configure on their own computer if
Yep, everyone can opt in for capturing or not, whether they want it. And I think it should do some at least decent translating as well.
okay. And then I did the closed caption. It says English. I guess it's on their set. I'm not sure. Oh, yes, this meeting is being transcribed. So I think we should be good to go, huh? Then we minimize. Um, and we can see it. Can we move this? Okay. Okay. Oh, there it goes. It's out of the way. All right. Gotcha. Mm. Uh-oh. Oh, okay. How do I go back? Okay, gotcha. All right. So that's all good. Alrighty. Well, we have 7 minutes. Um,
Yep. I think people will probably start joining here pretty quick. So I'll move to my background role. And yeah, just let me know when you want those polls to launch, Angela, and then I'll be keeping an eye on everyone that's coming in, all right?
alrighty, and I'm gonna check my emails to see if I'm getting any emails in. Alright. I'll be right back. Hello and welcome. Welcome, welcome, welcome. We have about 5 minutes before start time. Do what you need to do to refresh yourself, move around, get a cup of coffee. Oh yeah, it's still early yet. Have a glass of juice or water. Uh, Ready. I'm gonna do a sweep of my emails to see if anyone is trying to get in. In the waiting room. Oh, a few more coming in. Welcome, welcome, welcome. I've minimized my screen, James, so please let me know um when we're good to go. And all our panelists are here. I'm gonna do one more sweep of the emails.
Got it. And I'm sending one more out to all the registrants as well. So for everyone who's already in the Zoom call, sorry for the extra ping to your inbox. We just had to increase our Zoom room to a higher capacity one. So that generated a new link for us. I just want to make sure everyone's got it.
So, oh, Jen says she's in the waiting room. I'm not able to see. James, can you please let her in?
This does not have a waiting room, so she's on the old link, unfortunately. I'm gonna get
Okay.
that sent out right now, and everyone who's registered will get the reminder that it's updated and changed.
Yeah, this is a panelist.
We're good though yet, right?
Mhm.
Are-
Mhm.
okay.
Yep, we're all where we need to
All
be.
good. Hey, Matt's here. We're
Sorry
just
about that.
waiting.
I thought the call-in was in the invite. I didn't realize it was
Oh, no worries.
in the the what is it? The system that was closed.
Mm,
Yeah. And then we just have, we have Jen.
Hey, Sue sent it to me, so is he here? He must be here.
Yep.
Okay.
Oh, Angela, that last message that you sent just went into our direct messages in Zoom if you wanted the whole crowd to see that.
Oh, sorry.
No, you're good.
Yeah. I just sent a message to Jen.
Perfect. And we can give it another minute or two before we get started, just since we did have that change with the link, but everyone has got updated in their inbox if they registered.
Awesome, awesome, awesome. Um, so so we have all of our panelists here. And we're going to start in 1 minute. Alrighty. Let's get started. Welcome to today's panel discussion, Navigating Shifting Community Needs in Public Health, Turning Challenges into Solutions, the vital role of CHWs in addressing evolving needs. I am Angela Fields. I'm a community health worker, certificate holder since 2008, and I'm the Associate Executive Director of the Minnesota Community Health Worker Alliance, commonly called Mentor or the Alliance. For those of you that are maybe new to this platform, the Minnesota CHW Alliance is a statewide nonprofit partnership committed to advancing health equity. Our mission is to build community and system capacity for better health through the integration of CHW's community health worker strategies. Our vision is equitable and optimal health outcomes for all communities. Our focus is we work with our partners to reduce health disparities and achieve the quadruple aim that fosters healthier communities. The quadruple aim is improving population health, reducing cost of care, enhancing patient experiences, and improving providers' satisfaction. As I introduce the Alliance, I would also like to formally introduce myself. I'm a community health worker with a rich history of experience in healthcare and community-based initiatives. I am passionate about improving health outcomes for vulnerable communities with a focus on mental health, substance use, economical disparities, child and maternal health. Throughout my career, I've worked to bridge gaps in healthcare, empower individuals, and advance equity in underserved communities. I have with me today my colleague, James Walsh. He's our Mentor Communications manager. And he can quickly introduce himself. He'll be operating our technical, he's providing technical support and behind the scenes assistance for me today. James, would you like to introduce yourself?
For sure. Thanks so much, Angela, and thanks everyone for being here and attending. Like Angela said, I'm Minchua's Communications and Registry Coordinator, and my whole purpose today is just to make sure we've got a smooth run of show. I guess, Angela, if you want to move to the next slide, I can do a quick bit of housekeeping for everyone. Um, so obviously we're on a Zoom call. We're going to have a lot of people in this. It's supposed to be an active and lively discussion, but while Angela and our panelists are facilitating and discussing the questions, please just do me a huge favor. Keep your audio and video muted and turned off. That just kind of keeps for a clean visual while we're discussing everything and going through the questions and the slides. If you have a question, feel free to put it in the chat. I'll be keeping track of anything that comes through. We do have a dedicated Q&A section, and that'll be a good time to respond to things. But if you obviously want to get your thoughts out when we're talking about something that's more topical, please feel free to put that in the chat or raise your hand. I'm sure that we're going to be pretty open and maybe not casual, but definitely a little bit more freewheeling. We want this to be an open discussion. And then also, if you have any sort of accessibility needs, captioning is enabled in this Zoom call, so you can go down to the closed captions icon, turn that on. There are some limited translation capabilities. I can't speak to how good they are, but they will do English just fine. And then also, this meeting is being recorded, so please just be aware of that. It's being recorded. We are going to share this widely. This is a very important topic. We want to make sure that people who don't have the opportunity to attend are able to still see and participate in the discussion after the fact. So thank you all for being here. And if anything comes up, I will be here as well.
Thank you, James, for that support. Prior to me going over our training objectives, I would just like to kind of ground us and go over our purpose of this session today. We recognize that the past month has brought increased stress and uncertainty for many of us, especially given the national changes that are impacting families, communities, our colleagues, and even programs that we are connected to. During these challenging times, the Minnesota Community Health Worker Alliance remains committed to our shared mission of advancing health equity for all communities. Our commitment to supporting you includes serving as a resource, a catalyst, and a conveying partner. This is a formal call to action from CHWs. Over the past few weeks, I've been getting contact and emails and calls and such from CHWs that are actually boots on the ground, asking for advice and mentorship. Where could they find information? How could they connect with stakeholders and leaders in communities to really tap in and find out the accuracy of information, the availability of resources, or what this means for their communities? Also, on the flip side of that, being in a leading CHW role, I have the opportunity to sit in legislative work groups and advocacy and policy in various spaces. And so I'm privy to a wealth of information. And so I was trying to figure out how to merge that information and bring that information to our CHWs, our CHRs, and our Promotora de Salud across Minnesota. How could I share this information? And so taking that back to our team at Minchua, we said, this is a perfect call of duty from CHWs. And how could CHWs provide proactive patient client support? This is the feedback we're getting. How can we collaborate with stakeholders? You know, we're seeking input, we're seeking support, resources to build opportunities for the communities through a collaborative effort from our public health peers. CHW want to know what organizations and teams and core health settings and CBOs and groups, etc., how everyone is adapting to the evolving climate and landscape we have right now. How are these entities responding to challenges that are impacted through these changes? How can we effectively engage and collaborate with community-based risk reduction and intervention efforts? How do we address community needs safely accurately, all the while strengthening advocacy initiatives, and how can we develop actionable processes for things such as data collection and utilize that as powerful tools towards change? Can our data serve as a powerful tool for driving these change and reshape the narrative, and advancing the equity and advocacy through storytelling, while all the while ensuring that the CHWs are being proficient leaders out in the communities? In spirit of being inclusive, we have worked to create this space to bring diverse voices. And can we come together and share our perspectives? We have invited CHWs, CHRs, Promotora de Salud, leaders, champions from various fields, including youth services, housing services, chronic condition management, senior services, LGBTQ communities, and other diverse communities, including our tribal nations. We believe that a diverse perspective would enrich our conversations and help us better understand how to support all communities we serve, particularly during times of uncertain changes. So these training objectives will discuss how we can adapt in our role to policy shifts and emerging challenges, how we can explore strategies for supporting vulnerable populations, how we can learn practical steps for engaging and advocating for communities during difficult times. As we go through our agenda, responding to the evolving community needs in public health, we will spend the next 90 minutes in hopefully an engaging and thought-provoking conversation. Here we go. Had to tap it twice. I myself is Angela Fields, and I will be facilitating this panel discussion with you today. We have Jen Drake, the COO of South Dakota Voices for Peace. We have Laura LaCrosse DeLune, a lead strategist. We have Matt Flory, American Cancer Society. Uh-oh, where you go? We have Jesus Barrera from American Cancer Society. We have Nancy Frank Wilson from Minnesota Oral Health Coalition. We have Christian Godfrey Walters from Minnesota Department of Health. We have Michael Matisse from NASHWA, National Association of Community Health Workers. Yeah. And we have Connie Norman, CHW, Red Lake Nation. I'll start with our panel and introduce our panel in the order that I see them on the screen. We'll start with Jen. Jen is the Chief of Operations Officer for South Dakota Voices of Peace. With over 25 years of leadership and teaching experience, Jen is skilled community collaborator and advocate. As the Chief Operations Officer at South Dakota Voices of Peace, Jen helps oversee the day-to-day operations and provides support to all the staff. Jen is responsible for the educational programs and regularly presents and leads complex conversations on topics of diversity, equity, inclusion, being an upstander, individual purpose, and spiritual tapestry of South Dakota. We have Laura LaCrosse DeLune on our screen, and Laura is the owner and lead strategist. Laura has an extensive experience advocating for families, children, and communities, specializing in maternal and child health equity, early childhood services, children mental health, youth development, juvenile justice. Laura enjoys working with community partners and leaders to identify shared goals and solutions and creates effective strategies. Throughout her career, she has worked with state and local governments, nonprofits, and philanthropist partners to create equitable places, spaces, and policies. When she isn't working, Laura cherishes her time with family, travel, music, theater, cycling, and golf. And we have Matt Flory. Matt has worked for the American Cancer Society for 24 years. In his current position, he works with the health department, health insurance plans, and coalitions to promote cancer prevention and early detection. Matt is a past president of the Minnesota Public Health Association, MPHA, and is a current co-chair of the MPHA Policy and Advisory Committee. Then we have Jesus. Jesus is an experienced healthcare professional with a decade of expertise in quality improvement, leadership, and public health. Currently serving as Associate Director of Community Partnerships for the American Cancer Society, he is dedicated to fostering strategic collaborations that drive cancer prevention, advocacy, and awareness efforts within the community. We'll move on to Christian Godfrey Walters, MPHA, Minnesota Department of Health, Christian Community Health Worker Initiatives and Engagement Director, Health Promotion and Chronic Disease Division, Minnesota Department of Health. Christian is a Community Health Worker Initiative Community Engagement Director in the Health Promotion and Chronic Disease Division of Minnesota Department of Health, where she has oversight of the state and federal funded CHW initiatives in close partnership with the Minnesota CHW Alliance and key stakeholders to support the enrichment of the CHW workforce in Minnesota. Christian also leads division-wide initiatives to advance community care linkage and community engagement strategies. And we have Michael on our list. And Michael is the technical program manager with the National Association of Community Health Workers. As a member of Nashua team, Michael leads the project management, development, implementation, and administration of the organization's technical platform. Michael has deep experience working with vulnerable populations, both in indirect care and in project management development. Prior to joining Nashua, he worked as a major Medicaid MCO developing programs geared towards health equity, social determinants of health, and population health, with an emphasis on project management and technical aspects. Michael has a bachelor's degree of science with a double major in sociology, criminal justice, and from Northern Arizona University. And last but not least, we have Connie Norman. Connie has 35 years of experience in public health, serving as a community health worker in both rural and urban settings. She earned a degree in health and wellness counseling from College of St. Catherine's and completed her CHW program in Northwest Tech College. Connie directs Red Lake Community Health Services, a newly formed department where she supervised a team of CHWs as a targeted case manager. This program supports tribal enrollment members from any tribe or ISA eligible clients on medical assistance. Beyond her leadership role, Connie has served with various boards and committees over the years, and she is currently sit on the CHW Alliance board, on the governing board, and also on the governing board of Minnesota Public Health Association. Thank you all for being here with us today.
Hey, Angela,
Yes.
I think you forgot me.
Oh, no. I'm so sorry. I thought
No,
I did.
it's okay.
I
I
thought I
just
did
didn't
you.
want people going, what? Why is that woman?
I thought I did you fourth. Okay, where you go?
Did you? Did I miss it?
Wilson. Nancy Frank Wilson. No, I didn't. I'm sorry. I'm so
Okay,
sorry.
just want to make
Talking to
sure.
my head, not my heart. Nancy Frank Wilson has been an independent consultant in the area of public policy, communication, and organizational development with government and nonprofit organizations for more than 20 years. She holds a Master's of Science in Health Science and Public Administration, and past president and current governing council member of the Minnesota Public Health Association, has served on the numerous boards, including the Minnesota Department of Rural Health, Mothers Against Drunk Driving, and has served on the planning commission for the city of Plymouth, Minnesota. Nancy currently serves as the executive director of the Minnesota Oral Health Coalition, MOHC. The MOHC is a statewide nonprofit organization aimed at supporting the Minnesota State Oral Health Plan and increasing awareness, education, and access for optimal oral health. Thank you all for being here today and dedicating your time to this call of action on behalf of CHWs. As we transition with our time together, let's go. There we go. Start with our questions.
Angela,
Yes,
were we gonna do the land acknowledgement? Or is that later?
we can do that. We can definitely do that. We're gonna go.
Angela had asked me to do the land acknowledgement for opening this group. We begin by acknowledging that the land on which we gather today is the traditional and ancestral territory of the Dakota, Ojibwe, Ho-Chunk, Red Lake Nation, and many other indigenous peoples who have stewarded this land for generations. We honor the enduring cultures, contributions, and wisdom of these communities, past and present. We recognize that this land carries a complex history marked by migration, settlement, displacement, and resilience. We acknowledge the treaties that have shaped the relationships between Indigenous nations and non-Indigenous peoples, and we are committed to reflecting on the impacts these histories continue to have on our work, communities, and relationships. As we come together in pursuit of health and justice, we invite all to take a moment to reflect on the truth of this land's history and the importance of respect, healing, collaboration moving forward. May this acknowledgement serve as a reminder of our shared responsibility to care for each other and for the land. Miigwech.
Thank you very much, Connie, for that. As I move along, this is the first conveying session of this kind. Charge it definitely to my head and not my heart. Sometimes your nerves get ahead of yourself, but we're gonna ground us back and we're gonna keep moving forward. As we transition into our panel discussion, we'll devolve into the challenges and opportunities that arise as we navigate shifting policies, evolving community needs, and the impact of our recent changes. Our focus will be on how we can continue to support vulnerable communities during these transitions. We are fortunate to have a diverse panel of experts who are excited to share their insight, enhance our understanding of these critical issues that we face, and collaborate in strengthening our collective efforts to advance health equity for all. As we transpire into this first question is, in a time of rapid changing policies, how can professionals working in CHW roles and public health roles effectively adapt and ensure they are sharing timely and accurate information to communities that we serve? And Matt, if you could lead us on that and give us
I'll get you started.
get us
And then other people on the panel can pick up, fill in the gaps. I guess I think this is a great question and really appreciate being given the responsibility to start. I think community health workers are already good connectors. You're not just providing information to the community members you're talking to, you're bringing that information back to the physicians, the nurses, the dental health professionals. I don't know if those other folks are always listening as well as the community members are, but you already are doing that. And I think some of what I want to encourage people on this call to do is identify who your elected representatives are and develop a relationship with them. You can bring information from the community to them, but they will have information that's timely. So you don't want to just know what people are thinking about. You want to know where it's at. Well, if you get on the email list of your state legislators, maybe they're not the most exciting emails to read, but I get an email every week from my state House member and my state Senate member. That doesn't mean a relationship, but that's more information than I get in the Star Tribune, or it's different information than I get in the Star Tribune. It's complementary. It's more authentic sometimes than what I see on TV or in other media too, because I'm hearing from somebody. If you develop a relationship with them, it's not just about the information that you can bring to them. It's also that they might know where something is, and they're just people. So I'll pause there. Maybe we'll come back to it in other questions. But I think the best way to be on, especially as things are changing, if you have a relationship with somebody that's in the know about what's being considered before a decision is made, you're going to have way more information than you read in the newspaper or in TV. The other thing I would say is don't trust one source. Talk to lots of different people. Don't just read one newspaper. Don't just listen to one radio station, but trust your instincts. You're already good communicators of information. This policy information is just another kind of communication. It's the same kind of skill. Take a deep breath. People that are elected officials are just people too. They make mistakes. Some of them are nice people. Some of them are terrible people. You need to show them that you're going to keep showing up with the same questions. And if they don't answer them, they're going to get really tired of telling you, I don't have an answer. Eventually, they're going to have to start telling you something. I'm going to pause and see what other people want to add.
Absolutely. Thank you for that, Matt. So relationship development, being involved and active, being a part of where they are, signing up for mailing list, developing those relationships. And Nancy, could you?
Yeah, thank you. Yeah, Matt took a couple of mine. So we're like thinkers. I had take a deep breath. I'm actually in my free time, I'm taking yoga teacher training, and we had a long session last night about the energy we bring to the yoga class that we guide. And so I'm going to bring a little bit of that to this discussion. I'll just be frank. I think things are very difficult. The conversations I'm having every day are very, very different in tone and tenor, in the information we're covering. It's very different than the conversations I had 4 months ago, 3 months ago. So I encourage everyone to really take care of yourselves, because you're serving people and you're close to them and they need you, and you got to take care of yourself. You know, put the mask on first, put the oxygen mask on first, as the flight attendants say. And then the other thing I wanted to share was rumors. You know, things are changing very fast. I think every day something comes out of Donald Trump's mouth and I'm like, oh my God. And then, you know, like Matt said, take a deep breath. But rumors can crush us. And we really, a lot of times he will say something, and I'm picking on him, but he signed up for the job. Something will come out of the Oval Office, and it may just be something that, you know, rumors can crush us. And I'll give you a quick example. I work a lot with our critical access dental providers, and I was on it, and those are nonprofit dental clinics who see people without commercial insurance. Some are private insurers, private dentists too, but for the most part, most of them are nonprofit. So I'm on a national call, and they said, we're not having anybody show up to the church, to the school, to the community center for dental because they're worried about immigration. Well, I got an email later that was not even true. So that was crushing for me. I mean, I literally felt horrible. So I guess my point is, let's take care of ourselves. I love that. Take a deep breath. Check that things that we're hearing are really true, because we certainly don't want to make things more complicated. So thanks for letting me share that.
Thank you. So energy shifting, self-care, take a moment to pause, accuracy, and accuracy of information. And Laura, can you close this question out before we move on? Can you give us a brief closer?
Sure. I can, I think the piece that I would add, in addition to what I'm hearing is, we really want to make sure that we're helping families stay informed if we're working for them. I think many times as professionals, we think about it from our professional lens, and just really staying tuned in as how we can help families do self-advocacy. and in addition to staying informed, right? So helping people that we're working with, if they're not happy with how things are going with their care or happening in their community, how do they get connected to people? So I see Matt placed in the chat a link to find your elected official, but it's really important, in my opinion, that we're helping people in communities across the state, across the nation, know that they have the right to reach out, and that to reach out to their elected officials to share their opinions, whether they're in agreement or disagreement, and that they need to hear from you. Like, we literally elected them. We're a representative democracy. And so whether it's at the state level or at the federal level, they need to hear from people. And I know we'll talk about that a lot in this panel.
I want to add quick, I completely agree with Laura. Not only do they need to hear from you if they don't agree with you, but even if they do agree with you, I had this a really amusing situation with my wife where I was trying to tell her that she was really fired up about wanting to restrict handguns, and she's like, "Well, what's the point of contacting our legislators? They're all on the right side of things." And I said, "No, they want to hear from you." Do you think that she listened to me? No, she did not. But then she came back from a meeting where our state house member said, "No, I need stories. People, my colleagues are telling me you're not representing the people from your district. They don't believe what you believe." And she said, "I need to know what Melissa Flory said so I can say, well, let me tell you about this constituent I have, Melissa Flory."
Those
So
lived
it's
experiences.
even the people that are with us need to hear from us. You all, as community health workers, know way more about what's going on in your community than I know working at the Cancer Society. And health is my business. I've worked with ACS for
Absolutely.
24 years.
Absolutely.
I don't know how what's going on is affecting the Hispanic community or the African American community. I learned from talking to you. I need that information as much. I need that information a lot. These elected officials need it even more, especially the ones that are with us. The other thing is, don't just talk to one set of people. Talk to the people at the city, talk to the people at the county, talk to the people at the state. Practice so that you get more comfortable. The more time you practice public speaking, the better you get at it. And they'll say, "Well, that's not my job." You're like, "Well, can you help me reach out to them because they represent you too? I live in your city, which is in this legislative district."
Having those, yep. And
But
having
every
those-
time you talk to these people, you'll get more comfortable. You'll get more used to it. You'll get more confident. And you know what? They'll start to all talk to each other too. You're like, "Wow, Matt really doesn't go away." Someone
Yep,
introduced
and
me one
adapting
time as
to
a
those.
gadfly.
I hear your passion, Matt, and as we adapt to those changing, rapidly changing those dynamics that Laura and you and Nancy have started off, those key core dynamics is staying informed, staying connected to accurate information, building those strong relationships, and developing those connections, but also knowing your rights. And as we shift our second question is, how is regarding navigating policy shifts, what are effective ways? It's kind of almost a cursor of that one that we asked for. What are some effective strategies that CHWs and public health professionals can do to stay informed about these changes that we face, such as access to, resources? So on that community-based level, could someone on the panel speak about they work in community-based organizations, or they have a community lens that they see that through? Christian, could you lead us on that question?
Sure. I don't know that I was the point person on this one, but I can certainly jump in. I think as the others were talking, I think really staying informed about policy changes and communication updates, I think finding those forums and connection points to be sharing the timely and accurate information. So, maybe it's receiving information like signing up for MDH listservs, the Community Health Services mailbag, the, MNCHWA listserv, MPHA, getting, signing up for newsletters and emails and seeking out information that way and in multiple different sources. But also these forums such as this one for bidirectional communication, and, you know, those kind of timely, rapidly changing information, being able to have bidirectional communication through forums like this is also helpful.
Thank you for allowing me to pick on you, Christian. I appreciate that. I wanted to see how the flow from each panelist and their perspectives in, you know, these generated questions on how to adapt to change as well as navigating these policy shifts. And Laura, can you kind of
Sure.
pick up?
I can add a little bit more there as well. I did put in the chat a couple of our clients that we're representing are the Minnesota Prenatal to 3 Coalition and the Home Visiting Coalition, and that's how we've been working with the Community Health Worker Alliance here and then nationally. It's not going to have everything that you're looking for. I see Nancy also posted in the chat about the Oral Health Coalition. So there's lots of coalitions that will give you this information. I think some of the things that's important is depending on how much level of detail you want about the legislative process or congressional process, is a reminder is when a policy decision is made at the state level through our legislature, they will set a budget and they'll make policy changes, and then they'll put an implementation date for when this is required. And then the state agencies are responsible for implementing that policy or creating resources for that policy. And the reason I go into that kind of level of detail is that it's easy to think that something is going to happen right away if we heard about it or we read about it in like this coalition newsletters. But oftentimes it takes anywhere from 3 to 9 months to get a new program started or to actually change that policy and how it's being implemented. And so there's these different layers of policy change that we want you to be aware of. Is there's the advocacy side of moving forward bills and ideas, because really bills are ideas that sometimes are funded and sometimes have policy implications. And then once they pass, then they move into the agency to be implemented, and then resources go into the community. So really, many times these policy changes take quite a bit of time to be implemented. And then when we get into these times where we might be looking at budget shortfalls for our state in Minnesota, we are looking at a projected budget shortfall beginning in fiscal year 27, I believe it is. So there may be shifts in conversations about what resources are available. Minnesota is currently putting together its 2-year budget. We do it in a 2-year cycle. And they're planning for this projected deficit, even though we have a budget surplus this year. And they're also trying to consider all of the changes that are being thrown through, or that are being moved through the president's executive orders and the bills that are being going through the process in Congress and the U.S. Senate, which have really significant impact on your work and in your work with families across the state. So sometimes things, we're going to tell you that everything is on fire, you got to act today, because that's what every action alert will look like. I will always say, everything is on fire, you got to act today. But the whole idea is that you're telling your congressional representatives, this is really important. We want you to know this is important. And every step along the way, it remains important. We just try to pick and choose when we say, we need the community to be heard from. So I'm trying to differentiate the fact that it's always important to have those relationships. It's always important to have those conversations. And then there'll be times where we're going to ask you from the field to step in and make sure your voices are heard on really specific items.
Awesome. Thank you for that feedback for that. As we shift into our third question, and we talk about supporting diverse populations and diverse communities. Jesus, could you talk about, in light of the recent changes, are there some challenges that you've seen facing diverse backgrounds, and how CHWs and other public health professionals help to ensure that they're accessing services and resources they need?
Yeah, absolutely. I'd be more than happy to, Angela. I think I'll go over quite a few talking points that some folks on this call have already mentioned, but Just the reality of what things are going on with the challenges that diverse communities face currently, with just the recent changes at the federal government here in just a little over a month. There's been a lot of different policies that target specifically lower income communities and also community of color when it comes to accessing healthcare and other human services. Even things such as health facilities, schools, places of worship, they're no longer the safety nets that usually are traditional, especially when it comes to undocumented immigrants. As we've already alluded to on this call, with so many rapid changing policies at all levels of government, quite frankly, just on a day-to-day basis, I think for just CHWs, really just having a game plan when those conversations they come up with members of their communities and their colleagues. I'd say one thing which we've already started talking about on this call, it sounds like common sense, but just staying informed of what's happening at the local, state, and federal level, I think is extremely important. Something I advocate for is please on a daily basis, just read and watch the news, both locally and nationally, and make sure you use reliable sources. What I like to say, legacy sites to really, and legacy media sites to really be able to see a plethora of perspectives. Facebook, Twitter, Instagram, let's just call it what it is, folks. That's not TikTok. That's not an actual news source. Please, that's something that I encourage. I know for a lot of people turning on the news, like we've been talking about, it seems like Armageddon every other day with everything going on. But my favorite saying is, you might not have an interest in politics, but politics sure has an interest in you. So I think it's extremely important to be able to keep up with just everything that's going on. And it's just as simple as being able to just, at least for 30 minutes a day, really, and that really gets a chance to, even something we've alluded to, being able to make connections and relationships with your local representatives as well on the state level and also on the federal level. I believe my colleague Matt Fleury already put the website in where you can find your representatives, but I think that's also something that is extremely important and something that we've started talking a little bit about, but I think is equally just as important, especially as a community health worker. Those direct interactions you actually have with members of your community are very important. When you actually hear from a person, you get to hear how things are impacting them directly, and really,
Absolutely.
and you
It's
get a chance, and you get and oh, sorry, Angela, and you get a chance to actually be able to hear what is going on in their lives. We all have different experiences. We all come from different backgrounds, different socioeconomic statuses, different neighborhoods, you name it. But being able to really empathize and put yourself in somebody else's shoes and hear that this is another human on the other side is really, really important, folks. I think that's I think arguably, not just as a community health worker, but any profession, especially in healthcare, is really being able to step in and really check in. And I think as well, besides on the individual level, this is a great example, really being able to pool together community partners and other resources that you have.
Absolutely.
You have a chance to really take a burden off yourself and your organization, something that maybe I don't have at the American Cancer Society. One of my other partners might have, and vice versa, that we have resources, especially when you hear of budgets being cut on the federal level, even internal budgets. It really sometimes being able to stretch that dollar and those resources by being able to rely on just people and your partners that you have great relationships. It sounds clean. It goes a long way. Absolutely.
I appreciate you sharing that, and those direct encounters, the accuracy of the information, staying informed, being trusted messengers, those collaborative spaces, those coalitions that are building out of this, those advocacies, all are showing CHWs how we can better navigate barriers to essential services. This is also, there's a little, I would like to pull Michael in and talk a little bit about how Nashua has created a platform for CHWs to navigate through ever-flowing, evolving needs of the community. He'll talk a little bit about it now, and then he'll show a demonstration later on in our resource segment of the panel.
Yeah. So hi, I'm Michael. I'm from Nashua. And what we have and what we've built is the CHW connector. It's a web platform. It's also available on mobile app. And what we've designed it to be is a community of practice. Something there that was built with CHWs from the beginning, and all the way through the process to be for you, with you. And what we want it to be is, that place where you can go to find trusted information, to talk with fellow CHWs, to find and share resources. And it is something that we're really proud of. It is free, it is ad free, and we want you to log on and see where it's at, talk about the things that are passionate to you as CHWs, and learn from each other. I could go on for a whole lot more, but I think I've got more time for that later. But I'm gonna drop I'm gonna drop some links in the chat. So I hope to see you guys there, and I'll tell you more later.
Thank you for sharing that with us. Absolutely. I'm excited about that. I was a part of the initial project as an advisor a couple of years ago to see it evolve. I've been away from the work for a little time, but seeing it evolve into a functioning app is really exciting. And Jen, can you close us up on this question here and kind of walk us through how can CHWs, from your experience and your lens, help their communities navigate barriers to essential services such as medical, legal, housing, resources, etc.?
Well, just keep in mind that in recent months, in the recent days, with all the executive orders, there's been a lot of confusion and fear that has been developed. And when you're talking to your clients, be aware of where they're getting their news, and it probably is from social media. We have to acknowledge the emotions that they're going through. And when we're in a state of stress, we don't necessarily hear everything that is being given to us. So maybe we do need to be told multiple times. And so it is really important to acknowledge what people are going through. And then also understand that the language barriers, of course, with our multilingual communities, but there's some really big words that are being thrown around when it comes to policies. And you need to be able to explain it in layman's terms what is going on to help your clients understand what really is going on. And that's when you do reach out to those national resources. But when you're sharing information with the client, you do need to ask, especially in this moment when everything is changing so fast and there is so much fear, is this information that I'm sharing with you right now, is it going to cause harm? Is it useful? Is it something that we need to know right now in this moment? Because sharing too much information can be just really overwhelming. And it is important to know that many of our multilingual communities are not coming out and about like they used to. There is this fear, especially now with the registration coming and all of the different changing rules. Kids aren't going to school. People aren't going to the doctors. People aren't going out for food. People are in hiding and people are scared. And so we do need to meet people where they're at and understand that, name it, let them know we see it and that it's valid and that we understand it, but then ground them in the truth and in the facts that you can give.
Awesome. That was powerful. Thank you so much for that. Meeting people where they are. And that's what CHWs do. That's the core of our scope of practice. And we are grassroots public health professionals. So we're out in the communities. We go beyond the clinical and organizational walls. We are trusted messengers. We're advocates, and we provide that bi-directional communication that Nancy spoke about early on. Thank you for closing that out for me. And anyone else on the panel before we shift off to our next question. There we go. So this one here is about shifting federal funding priorities. And so I'm gonna direct this question. We're gonna take about 5 or 6 minutes or so. And I'm gonna divide it up between Laura, Matt, and Nancy. And with the shifting priorities in federal funding, how do we foresee these affecting CHW's healthcare systems, social systems, and local public health initiatives? And the second part about that, on that question, I will repeat it later, is what can we do to minimize the impact on communities that depend on vital services?
Yeah, thank you. I will start with this overarching piece, but I put in a link to the chat of our U.S. congressional reps and U.S. senators. If you don't know them, if you don't know people in their office, this is one of the best ways that you can engage in the process. With the election of President Trump and the U.S. Congress and Senate all being in one party, the belief is that they have a mandate to shrink the size of the federal government, and in the ways in which they're doing this feel really unprecedented to a number of people, and are really shrinking a power base in ways that we haven't seen in this country. But they believe they have the mandate to make these changes, and regardless of where you fall on this side of the pendulum and how you think this should be done, the link that I put in the chat is critically important, because again, going back to what we said earlier, is that our congressional reps need to hear from you, and what's really important is that we not only share whether or not you agree with it, but to help them understand the impact. And for somebody who's been involved in public policy for a very long time, what we tend to see happen in the world of public policy is that you make a small change, because levers of change at the federal level have a really big impact in ways that we don't always understand. And so the executive orders that we're seeing are sweeping changes. The layoffs we are seeing are sweeping changes. And to be really honest, we don't quite know the full impact. Like there were so many executive orders that passed all at once and so quickly, we truly don't know the impact. And so one of the things that I think is really critically important to us in the field of advocacy, and those of you as community health workers, is to help our elected officials understand the impact. So if you can write down a list of 5 to 10 things you know are going to happen because of these, and then send that off. Did you know this program here is going to be impacted? Because one of the very first executive orders was around putting a freeze on funding and saying it wasn't going to, the executive orders was to put a freeze on funding and to say it wasn't going to impact people directly. And that was very quickly clear that the people who made those decisions didn't understand what a big lever they were operating, and were completely wrong in their statement. And so they had to backpedal on a lot of these things. So when we're making really big policy changes, that lever is so large, it impacts so many people. I think what honestly is happening at the federal level is that the elected officials are understanding how broad that reach of federal programs and resources really is across the country. I think there's this idea that it doesn't impact a lot of people, but that they're starting to see that. And it's up to us if we're serving families and if we're working with families or in these advocacy roles, to make sure people understand and that they're actually making informed decisions instead of pretending that they don't understand. So I think there's so many things happening at the federal level that we have to be really diligent about educating them and expecting them to actually respond. And I will tell you what I've been told by our national partners is that we have to make sure that we are making phone calls right now, because emails and forms, like a lot of people are sending out forms, are going to go under the radar. So right now, if you have concerns, and we can talk about some of the specific things that we're seeing that will have concerns for your work as community health workers and the families you're serving, specifically the Medicaid cuts. I know we're going to talk about those very specifically, but they need to know and they need to hear from you. So you have to make phone calls. And that link that I put in the chat has the actual phone numbers. We need people to feel the pain of the changes that they're proposing, especially around the Medicaid that impacts so many of the families we're working with, as well as the reimbursement rates for those of you who are doing this work. Sorry,
Oh,
long-winded.
I just, Laura, you might have more direct experience working with them. I just put it in the chat. Our U.S. senators have staff that their job is to work on behalf of those U.S. senators to serve constituents. So you may even know the names of them. Isn't that right? Like they want to help.
Yep, exactly. They have local offices, but they're in DC right now. Call their DC offices because literally right now, Congress, they just passed this big sweeping resolution, and they are now in committee between now and March 7th, putting together the U.S. bills that would that they're looking at cutting $880 million out of Medicaid. And Medicaid is the #1 payer of mental health services in the state of Minnesota and across the country. It pays for 34% of births in this state, and most of the community health worker services fall under Medicaid reimbursement.
yes.
So this is going to dramatically impact services that you provide and how you're supporting families. And then it will go down to the state, and the state is going to have to decide how it responds.
Can we put those numbers in the chat today, or is that crossing?
I can put those in there. Yep,
Awesome.
yep. I'll put the numbers
Data
in.
is
Keep talking,
always
Laura. I didn't
awesome.
mean to interrupt you. I'm sorry.
I'll put them in the chat for sure, because right now, and I'll send you our action alert that we have on the Medicaid piece, but this is really significant, and the time is now. And this impacts most of our work as community health workers. And in that action alert, you'll see kind of some of the percentages like per capita around the state. This is not an urban versus a rural issue. Like per capita, we still have about 33 to 38% of people within every community who are accessing Medicaid. I think it's 1 in 5 across the state. So it really does matter.
And Laura, do you think it's worth it, even like I was saying before, to call the U.S. senators, even if we know they're supporters, to make sure they have the detail?
Yes, they're going to have the detail, but and they're not in power right now. The way that this is being moved forward is through what we call reconciliation in Congress, which allows them to make these budget decisions without having to rely on the other party. So these are Republican-led decisions right now because they're in the majority. I will say, I want to be really 100% clear. Both parties use reconciliation. So no matter who's in power, they will often use the tools they have to get the policies passed that they want. What we need to do, though, is make sure as constituents, because we're a representative democracy, that we're talking about the impact of cuts to Medicaid or cuts to SNAP, because many of you are working with families who have food insecurity. Those are very real cuts that we're looking at in the budget right now. And because we're putting together a 2-year budget in Minnesota, it's going to have a really big impact on our own 2-year budget.
So to ward off the impact, we as people, community health workers, public health professionals, to ward off this a trickle effect or these sweeping changes, we need to change our communication style. We need to go back to grassroots of how we once used to communicate with elected officials and policy members, making those phone calls, having those intimate conversations. It looks like now advocacy is key. And the Community Health Worker Alliance, we have a newly forming group designed to amplify the voices of CHWs across the workforce to advocate for policy and practices that promote the sustainability, the recognition, and the empowerment of CHWs across Minnesota. And so that's our CHW Advocacy Advisory Committee. We meet bi-monthly on Tuesdays from 4 to 5 p.m. Currently, it launched in January 2025. Currently, we have capacity for up to 15 CHWs to join that space. So if you're a CHW on the call, I can't see anything beyond the slides. Please feel free to reach out to me. I'll put my email in the chat, or I'll have James put my email in the chat, and we can have a conversation about what that space looks like. It's a designated space that's led, facilitated, created, and all action items are created by CHWs. As we shift to, thank you, Laura and Matt, for that engaging conversation. It was so much there to learn, and I'm a lifelong learner. That's one of my biggest skills. I got caught up in the data. I'm a data person. And as we move on, and we talk about what I'll gloss, we're going to change the order of the questions. Supporting, I want to get a perspective too, is supporting rural communities. And if I could have Connie start us out and Jen close us up on this question is, how can we better support rural communities through policy changes that address specific challenges such as resource limitations, cultural competency, access to training, and professional development for us workers, these opportunities in that space. So Connie, can you please come off the mic and lead us in that question?
Sure. One of the things that I think is interesting about, I feel like we've done some of this before during COVID. Now it's different, but with COVID, communities that had what I call silos put up between agencies, or in cases between tribes or whatever, that had to come down in order for us to work together. And I feel like that's kind of what I'm seeing in this area happening again. You know, and me working with Red Lake, we focus on the leadership from Red Lake, and we take our lead from them, you know, from tribal council, from the tribal chairman who was just in Washington and spoke, and he did a beautiful job for us. And I think too that what I feel like we see from a boots on the ground kind of perspective is that agencies are trying to reach out to each other and try to figure it out. But individually, as these agencies are trying to come up, we've been asked basically, because our program serves people with Medicaid and that are tribally enrolled, and we have the reimbursement rate, and our staff is terrified. And so I'm very new to this particular position, but one of the things that I did was I sat down with the team after we had a director's meeting, brought the information back to them about what they could do individually, because a lot of them say, I can't even watch TV or be on social media because I feel like I get overwhelmed or I'm triggered. And I do feel from the team's perspective, they've said, you know, we've kind of been through this before. We don't trust government. So that is something that is really real. And there is a resiliency there that I really respect from the staff, but also to give them the time and space and ask them what they need in order for themselves, and then how they take that to their client or to their relative, because that to me is a very important piece. So sharing this information today is really helpful because there's been some things that we've done just from a perspective of our staff. We did a traditional healing day and had a healer that came and worked with us for an entire day, you know, and then the resource doesn't stop there. There's other resources for our staff that the staff can then pass on to their clients. So it's kind of starting with, you know, the tribal leaders, and we're getting that information and it's coming down to us so we can be that boots on the ground and know the resources. But it's also been so important to keep the staff updated, to check in with the staff, make sure they're doing okay, because they're the ones that are going to be supporting these clients that are struggling just like they are. And so I think that that's one of the things, is providing as many resources, you know, like, you know, making phone calls and those, you know, like that. I think that is so, it's giving them something they can do. And it's some power for them to feel like they have some control when everything feels out of control, because we truly don't know what's going to happen next. So, you know, and then working on a contingency plan, and that involves everyone. So whether it's from the Red Lake tribe or the other tribes getting together, but also in this rural area in Northwest Minnesota, it's pulling together from the county perspectives. The different counties are reaching out, the clinics and hospitals, you know, other agencies coming together, very much like we did during COVID times when I was up here. And it's something that maybe is a way for us to learn that should always be happening, that it shouldn't happen during just this kind of critical time, but that we should be ready for the next thing, for emergency, some kind of preparedness or contingency plan. And that is something that we are working on right now. I think, you know, for example, when we started seeing the people being taken in by ICE and all that, there were a lot of people that felt very threatened, Native people. So they were actually, the tribes, I know Red Lake, I can't speak for the other tribes, but I know Red Lake actually encouraged all of their tribal members to make sure they had an updated tribal ID and that they were actually carrying it with them. So that was one thing that they could do to feel like they had something. Okay, I have some sort of protection, but it also is so triggering, you know. And so to me, that any of those things are triggering, but it's like, if you can give them, kind of keep them updated, which is what we do every morning. When we start our day, we start by smudging, but then we also have a talk about, you know, how people are feeling. And we try to keep it on the first hour is this positivity, focusing on positivity and what we can do to make the day better, even when there's other things going on, leaving room for them to find people that they can to talk to and providing those resources.
I like that. I like that.
Mhm.
So we're talking about, you know, resource building for the staff and the community, resource sharing on all platforms, that communal touch that is going on, planning and preparedness, traditional healing and cultural grounding and self-care, because we can't continue to pour from an empty cup. We have to find something that grounds us and gives us purpose to continue to do the things that we do and prevent burnout, but also mental fatigue for ourselves. And as great conversation. And Jen, if you could give us a quick closer, about 1 to 2 minutes or so, to close this question out as we transition to our final questions, as we roll over into the 1 o'clock hour. It's been a rich conversation, but I did want to save some time for Q&A and then a demonstration from Michael as well.
I would just add to Connie's comments that sometimes our CHRs, CHWs in rural and tribal areas feel very isolated and feel like they're an island onto themselves. So it's really important that we go to them and see what their what the circumstances are, see who they're working with, hear directly from the communities that they're helping, and to be able to be that backup or reinforcement so that the communities that they're serving see, oh, it's not just so-and-so saying this, they're connected to a larger organization. And when we feel like we're part of a team and feel like we're being supported, then it helps us propel us into continuing to do the work. So presence is louder than any word that we can say. So I think really, it's really important that we be intentional in our presence for our community members that are out there in the rural and tribal areas, and let them know that they're not forgotten, since so much focus is usually on the urban areas.
Thank you so much. And we are just we've created a theme: community engagement, collaboration, advocacy as drivers to move us forward. And I want to lead us into collaboration and advocacy. And in this space, I'd like to ask Christian, because she lead us off, is what is in your view, what is the importance of collaboration between public health professionals and community health organizations, health settings and such across the state and even national? What is the importance of those collaborations?
Yeah, thank you, Angela. I think we've talked a lot about all of the different roles that we all play in our different places and spaces. So we all have a role in the system that we have, which is why it's important for us to all collaborate. So as a state agency, for example, our role is to communicate health information and guidance, to monitor health and disparities in Minnesota, collect data, manage funding that goes out to organizations to provide the services that maintain and protect and improve health. So, our role, we play a specific role as a state agency, but being nonpartisan civil servants, for example, in communicating with policymakers, I might have a different role in providing direct information, providing fiscal notes, whereas someone or an organization like the Minnesota Public Health Association might draft a policy resolution, regarding community health workers or issues that are impacting people of Minnesota. And they might ask the Minnesota Community Health Worker Alliance to connect with community health workers on the CHW Circle or other venues to really understand and hear these needs on the ground. And of course, community health workers, the key role in that is being that bridge and that liaison and that advocate between individuals and communities and so many different levels, across our state and across our systems. Just highlighting, what we've talked about today, all these different places for advocacy and information and resources. And if we all work together and collaborate as a system in our different roles, we really can make an impact and a difference.
Thank you so much for that, Christian. And as we move along, we want to close out. These are our last questions. And as we move towards, we want to end on a positive note. I want to look at how we can build resilience through practical strategies for CHWs to foster us as well as those in our communities as we transition through these changing and often challenging times we see. And what are the opportunities do we envision for enhancing our CHW workforce and how we can be proactive to address the emerging challenges in public health? So if we could get like a 1 to 2 minute summary from the panel, we'll close that out. And then we'll go into our resource section and have Michael do a brief overview of the CHW connector, and then we'll open the floor for Q&A. Building resiliency. And the question is, what are practical strategies CHWs can use to foster resiliency within ourselves, and within our communities during these times of changes? And what are opportunities are envisioned for enhancing our CHW workforce, allowing us to be proactively prepared? Any one of the panelists can start, and we'll just do a round robin.
Yeah,
I think
this-
I can.
Oh, go
I-
ahead.
Oh, okay. I can start. I think really one thing that, with just as Angela mentioned, one way to really build resiliency with everything going on, I think being strategic as well. Really, I think it's easier said than done, but really especially with a lot of chaos, knowing when to react and when that, okay, this is just noise. I think that's also having to really differentiate. And it's almost the way I view it, almost like the art of war. You sometimes have to sit back patiently and really wait for an opportunity where something actually does come to actually make a difference. And really, it's really picking your battles to not be so overwhelmed. And I think really, even in any situation, in any negative situation, I think we can always pull a positive from, especially with our health system. I think as CHWs, the CHW career field is growing exponentially. Just according to the Bureau of Labor Statistics in the United States, over the next 10 years, there's like a 25% increase of just job opportunities across different. I think really being able to see the bigger picture. And yes, in the moment, some things are not pleasant to go, but seeing a bigger picture and really being strategic and being able to navigate and know, all right, we're going to sit back. This might have happened. We'll see how this plays out. But then
And we'll
I
keep
think
moving
that's something-
forward.
Exactly. I think that's really the best. And just believe me, the first 4 years, I did a lot of resistance politics. It's not necessarily sometimes the best idea either. And I think it's also good for just everybody's sanity. We've talked a lot about mental health, being
Yeah.
able to really just pick and choose what is important to put your gloves on.
Absolutely. As we prioritize. Thank you so much for that, Nancy.
I know we're here for policy, but I think with this question, I want to add, for community health workers, stay true to who you are, your origins, your training, your experiences. Right now, more than ever, boy, that really is. And then so stay true to that. Your
Absolutely.
training, your experiences, what you know, what you understand, trust yourself, really trust yourself. Couple real quickly, prevention is probably bigger now than ever. I know in dental, anything people can do to prevent, dental disease, like things like that. And there's a lot of free, really good resources. Like our Minnesota Department of Health is amazing, and a lot of the nonprofits. So I just wanted to share those little tidbits.
Absolutely. Thank you, Christian.
Thank you, Angela. I just wanted to highlight when we talk about opportunities for enhancing the CHW workforce and moving forward, MDH and MNCHWA are working closely with community health workers and key stakeholders across the state on CHW infrastructure and workforce development. And through a recent MDH environmental scan, we've heard both facilitators and barriers to advancing the profession across the state. And these are things that we can work collectively to address. The solutions might look different as there's changes in our national and state landscape, but the resources and collaboration opportunities in Minnesota are vast. And I'm confident that we'll continue to find a way forward. And one way to get involved is in shaping this vision is to join the stakeholder kickoff meeting that MNCHWA is hosting next week, March 6th, for developing a sustainable plan for community health workers in Minnesota. So we'll be kicking off the plan for CHW infrastructure and workforce development in Minnesota. And we welcome all community health workers and key stakeholders to help us move forward with that vision.
Thank you, Christian. You're so thorough. I can check that off my list. I had that in my announcements to end. Well, you took care of that for me. So see everyone on March 6th. Appreciate that. Jen, quick takeaway or quick summary, about 1 minute.
Yes, we need to redefine what winning means and be able to celebrate the wins, the small things. We also need to remember that the power's in the people. And that is sometimes we feel really overwhelmed and we think that the power is elsewhere and out of our control. But remember that collectively, our voices coming together, there's much that we can do. And a resource that I want to just share is Heather Cox Richardson. If you follow her as a presidential historian, what she is able to share every single day, she breaks down what is happening in DC, but then also relates it back to what has happened in history and what has happened on a global scale too. So just being able to hear from a historian of what has happened in the past kind of helps us strategize what we want to see in the future.
Awesome. Thank you so much. Connie, we get a takeaway from you, 1 minute, and then Matt, and then we'll end with Michael. He'll do the demonstration as we wind down.
I just feel that because we are the voices and we are advocates, that this is absolutely the time that we need to be stepping up. And if for those new community health workers or people who, and I have quite a few, who are afraid to use their voice, showing them how to do that. And this has been helpful to add a few things to what I've been asking them to do. And Jen, I love Heather Cox Richardson. I actually take some of that every day and talk to my staff about what she's talking about, just kind of to highlight, because it's accurate. It's, you know, that kind of thing. And I love that it relates back to history in every way. And so I just feel too that we need to make sure that we connect and stay connected. I think we need to also not be afraid to support each other in this, because we get, you know, like even from rural to urban, and I've worked in both, to just be able to all get together, like things like this and the thing on the 6th, I think really help us come together and find ways to, you know, oh, gee, maybe I should reach out to this person because I heard her talk about something that really makes sense for the rural area or for the urban area. I feel that's really important that we do look at this together. We're
Awesome.
stronger together, right?
Thank you. Absolutely, that collaborative force. And then Matt, if you can do us a recap or takeaway, 1 minute.
Try to keep
and
it to a minute, right? That's the inside joke. But I will. I think what I want to say is the journey of 1,000 steps starts with one. Nobody runs a 26-mile marathon the first time they lace up their shoes. And so don't feel like if this is new to you, if this is uncomfortable, you don't have to do it all at once. Just take the first step. Laura gave us a really good basic one. There's some phone numbers we can call to tell them about the impact of these cuts. It's very unlikely that if somebody even picks up the phone, they're going to have the time to argue with you. It's far more likely you're going to be leaving a message. If that feels uncomfortable, lean into that discomfort. Just pick up the 5-pound weight. But the other thing I think that's even more important, everybody on this panel is talking about how easy this, or talking about how important it is for you to do this. Let us know how we can make it easy for you. Follow up with us and tell us what you need besides what you've heard today to make it easier. But, you know, we need your voice. That's all I have to say. Thanks, Jen.
Thank you. Thank you, definitely. So, and 1 minute, Michael, you're on. To share resources. Do you need to share your screen, or what did you need from us at Mentor?
Yeah. If you can let me share the screen real quick, I'm just gonna show you.
I'm allowed to.
There we go. Okay, so I'm gonna put this up here for right now. While I say a thing or two. This is how you can connect to CHW Connector. That QR code there will take your phone to the appropriate app store. We would love for you to sign up. At Notchua, we believe in the strength and the resiliency of the community health worker, and that it's your knowledge and your professionalism that is going to make you special in the health and community fields. And when the times get hard, it's the CHW's time to shine. So we want to have this place for you that you can connect, be part of a community of practice, share with each other the tips, the tricks, the individual resources, and how to get your folks to them. It's really exciting to have. In less than a minute, I'll just try to say, really easy to sign up. 3 questions: your name, your email, and confirm that you're a CHW. If you're already a member of Nashua, you can sign in through your member clicks by hitting this button here. You'll see big keys here. There's all sorts of stuff there you can explore. But if you go into the communities section and hit discover, you're going to see all of our topic-based communities where you can go through and see where you can drive the conversation. You can make posts, you can share things and say, I'm looking for this. Who knows about this? I'm looking, I know about this. Here, take this and use it where you are. You're going to see the same issues in Minnesota that I'm going to see out my door here in Arizona, that other people are going to see in every other state across the nation. So if you can share and talk about what you know, that's going to be so helpful to others, and others can help you. We also have the other big feature I just wanted to say is the networks. So Minnesota Community Health Worker Alliance is here. Go in there, follow them, and hopefully they'll be putting out some posts soon to tell you about it and to let us know. If you don't join a community or you don't follow a network, you're not going to see what is put out there in your feed. I like to think of this sort of as Reddit for community health workers, made for you by you. That is my quick and easy, and I'm going to put this back up on the screen so that you can know what it is, know how to get to it. I am so proud to be working with and for CHWs every day. I am here to help. You can email me, you can message me directly through the app and our direct message feature, and I want this to be a great success for you. So thank you all, and thank you for letting me have a few minutes to tell you about this exciting platform that we've built for you.
Absolutely. Thank you so very much, Michael, for being a part of this presentation at such quick turnaround. Thank you for being flexible and being able to come in and show us this demonstration. This just connects us nationally now. CHWs from across the world, understanding the nature of the CHW Connector would be a place for CHWs to connect and communicate with other CHWs nationally across the nation. And to be able to have a one space to share information with each other, and then we can hear in real time what's actually going on in different spaces. So it sounds like a great definite app. I know the chat has been blowing up. We have 3 minutes left. I would like to bring to your attention, I have started collecting some resources and references to try to collect a directory of those, and our communications department will work on how to get those sent out to those that are registered for this session today. But I did want to call to your attention, and I know it was talked about early on in the session when we first started, was Medicaid Day of Action. It was established for February 6, 2025. For those of you on the call that may not be familiar with this, is on February 6, 2025 marks the Medicaid Day of Action, a crucial moment for communities across the United States, especially in Minnesota, as U.S. Congress considers cuts to Medicaid while preparing the federal budget for this year and the next. Medicaid is, as we know, is a lifeline for millions of individuals, as the data was coming through in this panel, including pregnant women, babies, young children, people with chronic conditions, those with physical disabilities, and those facing social economical barriers. With Medicaid coverage covering 40% of all U.S. births, cuts to this essential program would have devastating impacts, particularly for those of most vulnerable families and communities. So cutting Medicaid funds will have devastating effects for Minnesota and those across the country. So those, I'm pretty sure by now someone from somewhere has sent you those Medicaid call to action, please, or sign on for support. And as Laura highlighted earlier in the session, is we can't reach them conventionally online, or we have to reach out and call them. We have to talk with them and talk about this issue. We have to show up where they are. So I appreciate everyone and thank you all for joining this discussion. This was truly a fulfilling opportunity for myself to be a part of this platform. It was a great conversation that went forth about the vital roles CHWs, CHRs, promotoras, and all those that work up on the CHW banner or public health banner play in navigating shifting policies and community needs. The key takeaways that were highlighted on the power of collaboration and the need for us to continued advocacy for equitable policies and resources. As we move forward, let's keep working together to support our communities, strengthen our workforce, and ensure these communities have access to essential resources. Thank you for your commitment and your dedication to this important work that we do. Thank you for showing up. Please, please, please take care of yourself. A special thanks to all of my dear panelists. You guys just rose to this occasion. I only reached out to you maybe a week and a half, 2 weeks ago, and I kind of herded you in, like, do this, do that, do that. I really appreciate you allowing me to boss you around, so to speak. But I really love that you guys came here today as experts, as providers, clinicians, CHWs, promotoras, allies, stakeholders, community members. Thank you, thank you, thank you for truly being here. And so I would like to thank everyone, and we could adjourn. I will save the chat. I will gather all of that. Our team, our communications team will go over all the editing and various such like that. And as James mentioned in the beginning of our time together, we will, once editing has been done, he will distribute that through our platforms of communication. If you have any parting questions, please leave them in the chat. Also, we will be sending out a survey. James, if you can pop the survey in the chat for me. Oh, we have a few raised hands. I'm sorry. We have a few moments for Q&A. Please raise your hand. Oh, he was saying, please raise your hand. I'm sorry about that. And also on March 6th, please join us for our kickoff for our sustainable CHW sustainability plan. We want your voices. We want your participation. We want to hear what you're seeing and experiencing out there, or what you envision moving forward to sustain our CHW workforce. Thank you all for being champions of CHWs. Have a great day. I want to do like Michael did. I don't know how to do all the hearts.
Yeah, you did.
Oh, I did
Yeah, you
it. Thank you all. Thank you all. Thank you for being the professionals that you are, and for champions for CHWs and being dedicated to your community and your workforce. Awesome.
Awesome. Great work, Angela.
Thank you. I got my nerves after they started going down a little bit because I was revved up there. I was like, okay, bring the adrenaline down. Come on, come on. It's just a community conversation. Thank you, Christian. Thank you. You're welcome. Thank you, everyone.
Awesome. Well, we'll get this wrapped up and that'll get the recording processing. I'll get everything going from there. Sound good, Angela?
Okay, how do I save the,
Save the chat.
where does it
If
go?
you,
When I save it, where does it go? Uh-oh.
that's a good question. I think sometimes it saves it locally. I'll save it on my side too. Let's see. Yeah, it saves it locally into your documents folder.
Okay, awesome.
Mhm.
So
And I've got a copy of it as well.
okay, I don't need any technical on my end, do I? Anything
No,
else?
you should be all good. When we end it, it'll all be fine.
All right, I'm unplugging.
All right. Have a good day, everyone.
All right, good. Thank you. See you guys. See you, Michael. See
Bye
you,
now.
Connie.
Have a good one.
Have a good one. Thank you. Thank you, Nancy. She work in prenatal patients. We're currently seeing high numbers of patients who fear. Oh, yeah. Unfortunately, connect with us for follow-up or any of us on the call. And someone will be of assistance to you, to help you navigate those process.